So the plant that we're covering today is blue cohosh. There are some trigger warnings for today's class that I want you to take very, very seriously. Blue cohosh is primarily used as an abortifacient. Sometimes that doesn't work out so well. It is also used as a partus preparator, which is basically preparing a uterus to better go through the birthing experience. Sometimes that doesn't work out so well. It is also used to induce labor, and once again, sometimes that does not work out so well. So we are discussing an herb that has caused teratogenic effects, so birth defects, as well as deaths of both infants and the pregnant person who is either attempting to have an easier delivery or induce a delivery. Lastly, this is not a trigger warning, but it is a content warning. We support the right to an abortion. That's not something that we're willing to argue with while we cover this information. If you want to have it out with me about it, find me somewhere else. It's not happening in the chat. You are welcome to your own opinion. Basically, in chat, if you want to say, I don't believe in having an abortion, or I cannot have one because my religion does not permit me, cool, you can say that. You can say that all you want. If you start saying, well, you all should have to abide by my religion, then no, we're not playing. So I think that's all of my trigger warnings and content warnings that I need to include. And I'm going to go ahead and get started. I have no idea how long it's going to take me to get through this information, or if I'm going to be able to do it in one class. I do know I'm going to end up asking for more brandy despite my dehydration, because occasionally I make terrible decisions. That's a great idea. All right. Ian's such a good partner. So the plant that we're covering today is blue cohosh. This is not to be confused with black cohosh, which is an entirely different plant. It's not helped that they're often used together, like recipes often call for blue cohosh and black cohosh. Just published our Honest Witch book on this plant. We haven't gotten our proofs back yet, but it'll be posted soon. And when I was trying to find a botanical illustration, and in public domain, out of copyright image to put on the cover of the booklet, because we don't have the kind of money to pay for the rights for images, I kept finding images that were mislabeled on various websites where they were like, this is blue cohosh. And I'm like, no, the fuck it is not. That is black cohosh. On the bright side, I can recognize the difference, but it was driving me up the wall. Ian was present for my repeated, like, what the fuck? That's labeled incorrectly. Someone's gonna look at that and they're gonna go, oh, the botanical illustration says that this is blue cohosh. It drives me nuts. Anyway, moving right along. So the scientific name of blue cohosh, which is super important for making sure that you don't get things confused, is Calophyllum thalictroides. I think I said that right. I hope so.
As far as I know you did, but
my grandmother would be appalled at my Latin and my Greek and feel as though she had failed me in my learning. Anyway, common names include, but are not limited to, because common names proliferate.
Arbitrary.
Yeah. Squaw root, papoose root, both of which are problematic.
Everyone's a little bit racist.
Yeah, everyone's a little bit racist. Those are racist names. Let's not use those. Actia grapes blue. Wow, even my French is horrible. Blue ginseng, calophyllum copigamum, Calophyllum thalictroides, Cohosh azul, Cohosh blue, Granus achapelle, Leontis fopigamon, Cohosh azul. I had things on here more than once, and somehow nobody caught that before I sent it to print. Damn it. I need to do these ones before I send something to print. So the first edition that like 10 people are getting, it has an error. That makes it more valuable, right? No, that's not how that works. Etymology. Cohosh comes from the Romanized version of the Algonquin word meaning rough, referring to the appearance of the roots. The blue in the name refers to the blue berry-like fruits and the fact that it has bluish-green foliage. All right, moving into the general information. Blue cohosh is a native plant of the eastern and central woodlands of the United States of America. It has traditionally been used as a gynecological aid, primarily for the alleviation of amenorrhea, dysmenorrhea, and menorrhagia. It has also historically been used for labor induction, to assure a prompt labor and to reduce the pain of childbirth. It is also one of the herbs used to induce an abortion. Blue cohosh should not be confused with black cohosh, Actaea racemosa, also called Simicifluga racemosa. Again, they're confused for each other a lot, but they don't even belong to the same genus. And they don't have the same effects on the body. So please don't make that error. When someone says, oh, this is cohosh, find out which one, preferably with the scientific name. History. The use of herbs prophylactically during pregnancy to expedite and ease labor dates to antiquity. So long as pregnant people have been giving birth, there have been methods to ease the pain of childbirth. That is an excellent decision, Lydia. It is sometimes very helpful to just completely issue common names. One of the reasons I go ahead and include them is so people have any idea what I'm talking about, because common names are generally what is commonly used. And if I posted this under the scientific name, most people would have no interest, even if they were interested in blue cohosh. Additionally, one of the benefits of a common name is that many of the memory techniques to help you recognize and differentiate between plants are based on the common name. So it's up to you if you want to include that or not, but something, for example, the blue helps you remember that the foliage should be blue, that the berries should be blue. Which you can just memorize. You don't have to use the common name to do so. But for example, Queen Anne's lace. How you tell the difference between Queen Anne's lace and several rather poisonous lookalikes, one way is to remember to look for the hairs on Queen Anne's lace legs, which is, look for the hairs on Queen Anne's legs. Never mind. I'm just gonna move on. I feel like nobody else's grandparents made them remember this kind of thing. Maybe not nobody else's, but it's certainly not common. Anyway, where was I?
Drinking brandy and water.
Thanks.
I don't think that's where you actually were, but it's where you were now.
The use of blue cohosh for this purpose was first introduced to white colonizers of the United States of America by the native inhabitants of the Americas. So the First Nations people who already lived here and cultivated these permaculture food forests with all of these medicinal herbs that they were making use of, taught it to the colonizers and essentially said, this is what we use. And the colonizers were like, wow, that's really effective. And then named it a really racist name. Ojibwa wise women used a strong decoction for contraceptive and abortifacient purposes. I'm gonna mispronounce this, and I'm sorry, cousin, if you're watching this. Please walk me through the pronunciation the next time we're on the phone call again. The Anai Yawaya, I'm trying. The Meskwaki, the Menominee, the Potawatomi, and the Omaha First Nations people are all documented as using the herb for issues related to menstrual cycles, pregnancy, and giving birth, but are not explicitly documented as using it as an abortifacient. I really need to brush up on like all my pronunciation, English, Greek, French, butchering things. Okay. Most reports credit the Algonquin, also referred to as the Algonquin, people for transmitting the knowledge of its use to colonizers. The Dispensatory of the United States in the 24th edition from 1947 states that blue cohosh was used by Native Americans, whose nations were unspecified in this particular booklet, to facilitate childbirth, a practice reported to have been brought to the attention of the medical profession by Peter Smith in 1813. Smith was referred to at the time by the title Indian doctor, which contains, of course, an exonym and slur for the First Nations people of North America who have nothing to do with India. Thank you very much. And by very much, I mean not at all, you murdering asshole. Columbus.
Murdering idiot. Asshole.
Yeah.
Incompetent murdering asshole. There we go.
The term Indian doctor was a description of an herbalist who studied and used the native North American plants in a way similar to how the First Nations people did. It did not necessarily denote that a physician had Native American ancestry or that they had made any kind of direct study with Native Americans, or that an herbalist assisted Native American patients or clients. So you could call yourself an Indian doctor and be called an Indian doctor and never have any direct contact with First Nations people. Right?
And also not be a doctor.
And also not be a doctor, and also never been to India. American history is
It's
so
funny.
great and racist, isn't
Every
it?
word of that sentence.
Right, every word of that sentence is wrong. In his book, The Indian Doctor's Dispensatory, blue cohosh is mentioned for the first time in recorded Euro-American medical literature. Raffinesque, circa 1828, a natural scientist who lived with the First Nations people of the Americas to study their natural remedies, brought further attention to blue cohosh in his book, Medical Flora. He called it a powerful emmenagogue promoting delivery, menstruation, and dropsical discharges. It was likely Raffinesque who suggested the name blue cohosh based on the dark blue berry-like structures. He attributed the word cohosh to the Algonquin word for rough, referring to the texture of the roots. Now, he's who said that that's why it was named that. I actually couldn't find any primary sources from the Algonquin First Nations people as to whether that is at all related to their word for rough, so, you know, take it with a grain of salt. In the 19th century, ergot, claviceps, a fungus that grows on rye and other related plants, was the primary method used by midwives and herbalists for labor induction. Ergot caused and causes extremely strong and uncontrollable contractions with great risk to the pregnant person and fetus. Blue cohosh quickly became regarded as a gentler and safer alternative to ergot by the eclectic physicians. The eclectic physicians were American medical doctors from the early 19th to early 20th centuries who blended naturopathic First Nations remedies with the scientific allopathic remedies popular at the time. If you...
Right, eclectic physicians were actually physicians.
Yeah, if you feel like watching a somewhat problematic but also way ahead of its time TV show, you could check out Dr. Quinn Medicine Woman, which is actually based in the lives of 3 different female eclectic physicians who studied First Nations remedies and blended them into the naturopathic remedies at the time. They actually sort of blended these 3 historical figures together and drew from each of their lives because it's a TV show that spans multiple seasons and they wanted lots of drama to pull from. But it's fictionalized, it's Hollywoodized, there's some problematic elements of it because any show that has that kind of white savior complex. It's going to have some problematic elements, but it's still an interesting exploration of how medicine evolved at the time. If you're looking for a TV recommendation. Anyway, Grammy used to like it. We watched that one together. Anyway, in 1835, a chemical analysis of blue cohosh was performed. In around 1863 to 1864, scientists identified saponin and glycoside fractions in the plants. Soon after, an alkaloid fraction was also identified. These constituents and the isolation methods used were described in detail in American pharmaceutical literature of the time. The glycoside fraction was said to resemble quinine in appearance and was demonstrated to be soluble only in alcohol. This is important. The glycoside only dissolves in alcohol, but this is the only study that's confirmed. But that comes up again later.
Right. It would be really nice if someone would take the time to repeat this study.
Please repeat this study. It's actually really relevant, but we'll get there. A resinoid compound obtained from the precipitation of strong alcohol tincture in water and called calophyllin was thought to contain the amenagogic principle and was sold as the 1% solution Lloyd's Leontin. Basically, they figured out what they thought was causing it to act as an amenagogue, so something that brought on the bleeding part of the menstrual cycle, and started selling that. So as a reminder, you can check out our history of abortion documents. Up until very recently, it was quite common to be able to purchase strong amenagogues and abortifacients from your pharmacist and right out of the newspaper. And
Right.
this would have been one of them.
Take newspaper ads, chemists.
Yeah.
They all.
Go back and forth between my brandy and my water.
This being controversial is relatively new.
Yes. The National
And incredibly classist.
Dispensatory 5th edition from 1896 cited this early pharmacology work, suggesting that no further analytical work had been done. John Uri Lloyd, 1849 to 1936, and Curtis Lloyd, 1859 to 1926, influential American pharmacists and the founders of Lloyd Brothers Pharmacists, described the use of blue cohosh in one of their pharmaceutical bulletins. Quote, when used by delicate females or those subject to prolonged and troublesome labors for several weeks previous to the parturient period, it appears to impart tone and normal action to all the powers engaged in this important process, facilitating its progress and relieving the woman of much suffering. For this purpose, it is frequently administered in combination with other agents and given in proper doses 2 or 3 times daily. During labor, when from fatigue, debility, or impaired uterine nervous energy, the contractions become feeble, inefficient, or very severe and of a spasmodic nature, or have entirely ceased, the administration of calophyllin in decoction or even in powder will be found preferable to ergot, as the contractions aroused by its action are less violent and spasmodic than those affected by ergot, and more nearly resemble the natural ones. In severe afterpains, more prompt and efficient relief will follow the use of calophyllin than from any other agent, in doses of from 2 to 4 grains, administered if necessary every 1, 2, or 3 hours. John King, end quote. John King, in 1855, one of the renowned eclectic physicians and author of several botanical medicine textbooks, recommended the blue cohosh as a preparatory parturient in his book American Eclectic Obstetrics. He developed a formula he called parturient balsam in cases of impaired or delayed birth. The herbs were to be ground, mixed, and macerated in 76% alcohol for 2 days, percolated in hot water, and finally boiled down and sweetened with sugar in order to form an elixir. King agreed with Lloyd, stating that blue cohosh, quote, will frequently be found more desirable than ergot for expediting delivery in all those cases where the delay is owing to fatigue, debility, or want of uterine energy, The contractions it occasions will merely resemble the natural ones, instead of the continuous spasmodic contractions affected by ergot. End quote. Blue cohosh was also recorded in his textbook, King's textbook, to be beneficial in the treatment of after pains, for which it was to be combined with the uterine antispasmodic herb Viburnum opulus, also called cramp bark. A similar and related blue cohosh containing formula available to this day on the herbal market for gynecological complaints is called Syrupus mitcale compositus, compound syrup of partridge berry being Mitchella repens scientifically, or more popularly it is referred to as mother's cordial. If you're going to find it online, it's probably called mother's cordial. Mother's cordial contained, and still contains, blue cohosh root, Calophyllum thalictroides, spikenard root, Aurelia racemosa, black cohosh root, Actaea racemosa, also called Cimicifuga racemosa, the leaves of the partridge berry plant, Mitchella repens, the berries of the partridge berry plant, Mitchella repens, queen of the meadow root, Eupatoria purpurea, lady slipper root, Cypripedium pubescens, comfrey root, Symphytum officinale, false unicorn root, also called Helionis.
You missed something?
Yeah.
Damn.
Actually, I've noticed several errors. So from now on, I have to read these aloud for a class before they can be sent to print.
Sorry.
We had 3 different editors go over this. So it's kind of like, how did we all miss that? Camelarium luteum and high bush cranberry, Viburnum opulus. King's America Dispensatory by Felter and Lloyd in 1898 describes blue cohosh as an oxytocic and says that it is used to, quote, relieve false pains and uterine irritability, spasmodic uterine contractions, and for uterine subinvolution, end quote. The dispensatory also states, quote, there is no doubt but that Calophyllum has a decided action upon the gravid uterus. During labor, it relieves false pains and coordinates muscular contractions, at the same time increasing their power. It is a better oxytocic than ergot. It stimulates normal contraction instead of inducing spasmodic uterine action. As a partus preparator, blue cohosh has enjoyed a well-merited reputation. When used by delicate women, or those who experience prolonged and painful labors for several weeks previous to confinement, it gives tone and vigor to all the parts engaged in the accouchement, facilitating its progress and relieving much suffering. It is a good remedy for after pains, especially when spasmodic in character. It is a remedy for hourglass contraction and for spurious labor pains. Anyway. In addition to use by the eclectic physicians, numerous dispensatory books,
Pharmacopoeia?
No. I don't know what word I was going for there. I know that that's a word. I just can't remember how I'm just going to say pharmacological texts.
Oh, yes.
That word. The pharmacognosy.
Yes.
Yeah. And materia medicas.
Actually, I think you got that about right. Just like
Did I?
Well. Yeah.
Oh, good. Cited the use of blue cohosh as an emmenagogue or oxytocic drug, including the National Dispensatory, a textbook of pharmacognosy, and Materia Medica, Toxicology, and Pharmacognosy. I wrote this out, and I can't pronounce it. So, its use was recorded. It's been a long day, and I'm really overheated. Its use was recorded in the United States Dispensatory 12th edition in 1866, in which Doctors Wood and Bachet wrote, it is deemed especially emmenagogic and is thought to promote contractions of the uterus, for which purpose we learn it is much employed by the, quote, eclectic, end quote, physicians. Yeah, even at the time, they got treated a little interestingly. Anyway, in 1880, blue cohosh became an official drug in the 5th revision of the United States Pharmacopoeia and remained so through 1955, though it was removed from the list of United States Pharmacopoeia approved substances after 1880. So I just want to make sure that that is understood. In 1880, the 5th revision of the United States Pharmacopoeia says this is a drug. We recognize this as a drug. Then after 1880, it stayed in there as a drug, but became an unapproved drug. Basically, this is no longer a substance that we recognize as a drug we want to say you should be taking.
Right.
So, the eclectic physicians continued to use blue cohosh as an emmenagogue and Pardus preparator into the early 20th century. The American Dispensatory from 1908 noted the contradictory powers attributed to blue cohosh. On one hand, it is described as being a sedative and antispasmodic, yet it is also described as being oxytocic, to have the power when uterine inertia occurs during labor to cause the contractions to become very severe without altering their general character, as does ergot. It is simultaneously alleged to be capable of arresting a threatened abortion and to be capable of originating uterine contractions and producing abortion. Starting in 1916 through to 1950, blue cohosh was officially listed in the National Formulary for labor induction. Sorry, I'm seeing comments. Are you... Okay. By the early to mid 20th century, first quinine and then pituitary extract became the primary medications used for labor induction. With the increasing safety and controllability of the latter, as well as a shift from births occurring in the home to births occurring in a sterile and hospital environment, and with the era of the eclectic physicians drawing to a close, the use of blue cohosh fell out of favor. By the 1920s, several pharmacological compounds have been isolated from blue cohosh, including methylacetytosine, a crystalline alkaloid previously called calophyllene, calosaponin, a crystalline glycoside previously called leontin, and colophyllosaponin, a polysterol. The plant was also known to contain a volatile oil, an enzyme, a reducing sugar, a resinous substance, and a mixture of fatty acids. So that's what they knew about it at the time. Moving into recent history. In 1978, the late midwife herbalist Janine Parvati Baker published Hygeia. I should probably have looked that up before I started teaching this. A woman's herbal, which reintroduced the use of blue cohosh as an emmenagogue and uterine tonic to the greater birthing community. In the early 1980s, there was a revival of the use of plant medicine in the birthing community, including use of blue cohosh as a Pardus preparator. So I've used that term several times. I just realized I haven't defined it. I did?
You did.
Oh, good. Yeah, Pardus meaning labor, preparators meaning preparatory. And for labor induction and augmentation. At the time, less than 1% of people were giving birth at home. Many pregnant persons were incorrectly told by their gynecologists and obstetricians that they could not give birth at home past 40 weeks. And so they were seeking an herb that would induce labor before their home birth was no longer deemed possible. Many herbalists will tell you that after 40 weeks there is an increased risk, and many obstetricians will tell you that as well. And I'm not going to disagree with them. I'm not a medical professional. They were told that they couldn't. Now, many midwives say that you can. You can still give birth after 40 weeks, but that's one of the reasons why it became more popular, because they were looking for something that would induce labor so they could still have their home birth. Okay. During the 1990s, certified nurse midwives who were practicing in hospitals and birthing centers also began to make use of blue cohosh, as well as other natural methods of labor stimulation and augmentation in order to assist their clients in meeting the criteria for low-risk pregnancies that allowed the pregnant person to stay in the birthing center rather than transferring care to an obstetrician or hospital. Many birthing centers' licenses require that births only happen there if they meet the standard of low risk. And so if they're past 40 weeks or sometimes past 42 weeks, then unless labor is induced, then the person has to give birth at a hospital and can no longer make use of the birthing center, whether or not they would prefer to. More general interest in the herb began to occur in the late 1980s and early 1990s, coinciding with a generally increased public interest in natural therapies and as a reaction to increased rates of labor induction by obstetricians, for which pregnant people were seeking natural alternatives. In the late 1990s, as the use of herbal medicine was becoming more commonplace amongst nurse midwives and midwives, articles about herbs began appearing in nurse midwifery journals. So the nurse midwives started saying, okay, we're not allowed to provide this service for our clients unless we can say that we do it safely. They will say it is unsafe unless we have these certain things occur with certain timing. So we're going to start making use of these herbs that can help us do that, and we're going to educate each other about those herbs. In 1995, a certified nurse midwife named Cindy Ballou wrote and self-published a manual called Herbs and the Childbearing Woman, Guidelines for Health Providers. It detailed using blue cohosh as a Pardis preparator in a large number of cases, and notes that blue cohosh can have a hypertensive effect. So this is the first time that one of these physicians I could find, I mean, it may have happened before that, but this was the first one that I could find where one of these natural midwives says, hey, I understand that we think this is so great and I've used it a bunch of times, but it also has this issue. Okay. The first case reports of adverse neonatal outcomes associated with ingestion of blue cohosh during pregnancy began to appear in medical literature in 1996. So around the same time, they started saying, hey, this is really common in use right now, but we're starting to see it attached to some negative outcomes. During the late 1990s, herbal medicines became increasingly popularized. In 1997, Harvard physician David Eisenberg wrote a paper that demonstrated that the use of herbal products was not only on the rise, but that Americans were paying an estimated $27 billion in out-of-pocket expenses for complementary and alternative medicines. Of the herb books published during the rising interest in alternative herbal medicines, most had a section on blue cohosh detailing its use in the last 4 to 6 weeks of pregnancy. In 2005, an herbalist who had assisted with home births named Thierry Ona Lodog wrote the book Woman's Health in Complementary and Integrated Medicine. In the book, she asserts that while it is impossible to establish causality between the herb and case reports of adverse events in pregnancy, based on the current available evidence, herbalists and midwives and obstetricians should avoid the use of blue cohosh during pregnancy. The rate of induction of labor more than doubled from 1990 through 2010, from 9.6% to 23.8%. So that's a big increase. Induction rates were at least twice as high in 2010 as in 1990 for all gestational age groups except post-term births, which rose a staggering 90%. So a post-term birth is anything defined as being past 40 weeks.
So I actually have a question for you.
Yes.
And this is a little bit on the spot. Is that it rose by 90 percentage points or 90%?
90%.
Okay, so it essentially doubled.
Yeah.
Okay, for those in the audience who aren't familiar with statistics, a 90% increase means that the number increased by not by an additional 90% of what it additionally was. So it did just short of doubling.
Then no, I answered you incorrectly.
Okay, so it went from like 5% to 95%?
Come look at how I took the information off the study.
Okay, that's fair. Because this is a statistical question that is
Because it's
often
comparing it
phrased.
to this. 9.6 to 23.8%. This, in contrast, rose to 90. 90% of all post-term births.
Okay, I see what you're saying.
Yeah,
No,
so no, it's the
the
opposite
other-
of what
the other one.
Ian's
So
saying.
post-term birth, the rate of induction for post-term births rose to 90%.
Yeah, the other ones more than doubled because
And-
they went from 9.6%
To-
of all births reported
To
to
23.6.
23.8.
Whereas this one, 23.8, whereas this one just went up to 90% full stop.
Yes.
Okay, thank you. That was the
Yeah.
clarification that I wanted.
I'm sorry, I didn't understand what you were asking
Yeah,
me,
no,
but I
it
knew
was-
that you'd gotten it wrong. I was like, no, it's the other one that almost doubled.
Okay, thank you.
All right, just to clarify,
Right,
because
we-
my
we-
head feels like it's going like this. 90% of the post-term births recorded had an induced labor. Yes.
Awesome.
Very tricky wording. And we don't want to deceive anyone with statistics. Okay. As of 2019, the American College of Obstetricians and Gynecologists reported that 20% to 40% of all labors are now induced. So does that make it more
Yes.
clear? Cool.
Thank you.
Also, found another error.
Okay.
I'm fixing them as I go, but like for part of this paragraph, I used one way that you write percent, and for part of it I used the other one, and no one caught it. I didn't catch it, you didn't catch it, our other two editors didn't catch it. Alright, this is due to a combination of factors, including but not limited to the fact that obstetricians and other birth professionals have, as a group, begun to prefer to schedule births rather than allowing for labor to occur naturally. So, I have a midwife friend who has talked with me about how much pressure there is to schedule your birth in between the physician's tea times on the golf course. Yeah, moving right along. Likely due to an increasing pressure to induce labor, the use of blue cohosh, particularly in birth centers and by home birth professionals and midwives, is on the rise. In spite of concerns that have arisen over its use in the past decade, blue cohosh continues to be sold in most health food stores in the United States, prescribed by obstetric care providers, bleh, and used by pregnant people. And I just caught a use of pregnant women instead of pregnant people.
Damn it.
So,
That was bad.
yeah, we can't ever.
Yep.
I'm actually tempted to
Send out a corrected edition.
send out a corrected edition to all of our
We
patrons.
may have to. We will
Oh,
definitely
okay.
send out a corrected PDF. We may send
I
out
thought we actually did Control F, where we tried to make sure that we
We
always
did.
said people.
I don't know how that happened.
Anyway, pregnant self-prescribers and obstetric professionals, including midwives working in homes, at birthing centers, and in hospital settings, still make use of blue cohosh to the modern day. In one study, 64% of midwives reported using blue cohosh to help facilitate childbirth. So, that's the history. Let's talk about how poisonous it actually is. Yeah, that's the fun part, right? Maybe? How poisonous, how harmful? Incidents of poisoning with blue cohosh are almost all related to its use as an abortifacient or Partis preparator or as a labor inducer. It is rare for use of blue cohosh as an emmenagogue to result in lethal side effects.
Rare doesn't mean impossible.
Yeah. Ingestion of blue cohosh as a Partis preparator may cause a range of fetal and neonatal side effects and adverse outcomes, including tachycardia, increased meconium, and increased need for resuscitation. In one study of the teratogenicity of blue cohosh, small doses of blue cohosh were found to be lethal to the embryos of rats when dosed in vitro. Effects on the body. There is a limited amount of literature on the pharmacodynamics of blue cohosh. Given the potentially harmful outcomes that are possible from misuse of blue cohosh and the large volume of midwives and other birth professionals making use of it, the lack of pharmacodynamic research is really concerning. This herb is in broad use. It is in broad use in the home birth community. It is in broad use in the nurse midwife community. It is in broad use in the herbalist community. It is sold in stores. The fact that it works as an emmenagogue and an abortifacient and a Pardis preparator and to induce labor is everywhere online. It's not hard to find. You can Google herbs to induce labor, pops right up. You can Google herbs to induce abortion, pops right up. You can Google herbs to bring on a menstrual cycle, pops right up. You can Google herbs for Pardis preparators, pops right up. The issue with this is that many of those websites list the plants and then don't give any information as to what it can do that hurts you, what herbs it interacts with, what medicines what the lethal dose is, side effects, all of that.
Dosage in general.
It doesn't even, oftentimes it's not even covering accurate dosage. And one of my big issues is how long they tell you that you can stay on it, and I'll get there. The plant it contains a poison. It's an effective abortifacient and labor inducer because it contains a poison. I listed it under the poison path for a reason. Anyway, continuing. Most of the scientific literature on the effects of blue cohosh on the body consist of analytical chemistry studies done to identify, isolate, or quantify the alkaloids and saponins in blue cohosh rather than clinical studies. No clinical trials, including retrospective or prospective studies, have been conducted on the use of blue cohosh by obstetric practitioners. They have not ever done a broad scale study of every person who is using this in an obstetrics, they haven't gone to a birthing center and observed the effects on every single person who's using it. They haven't done a study where everyone's taking this in controlled dosage during a certain portion of the pregnancy. And I'm not really sure how you would ethically put together a study, but there hasn't been one.
Right. There are ways of conducting statistical analyses of existing data without performing a controlled trial in order to determine causality with a high degree of certainty, which is what they generally do in cases where there's no ethical way to actually conduct the trial.
Yeah.
That has not been done either.
No, it's not. Thus, while much of the scientific literature assumes a causal relationship between blue cohosh constitution and harmful effects on the body and on reported adverse outcomes, adequate studies to establish possible causality have not been conducted. The plant and its extracts contain the alkaloids N-methylcysteine, baptifoline, anagyrine, and spartine, among others, some of which are toxic and have been implicated as teratogens. The pharmacological actions of several alkaloid and saponin glycoside components in blue cohosh are consistent with possible mechanisms for reported adverse effects. So basically, this is me trying to say, scientifically, there haven't been the studies to prove it, but we do know what these things do to the body. And what these things do to the body should not be being done to the body for 4 to 6 weeks during pregnancy. All right. It is also an estrogenic herb, meaning it contains estrogen-like substances and can have estrogen-like side effects. Blue cohosh contains at least 2 substances that cause the uterus to contract: oxytocin, a hormone produced during childbirth, and calosaponin, a unique substance found only in blue cohosh. Intriguingly, blue cohosh is also recorded by various herbalists as being a smooth muscle relaxant and it's been used as such for over 100 years. Some herbalists insist that if blue cohosh is processed in glycerin, it will only contain the relaxant qualities, and if it is processed in alcohol, it will only contain the contracting qualities. No clinical or chemical trials have been conducted regarding differences in chemical constituents found in glycerin and alcohol-based preparations of blue cohosh. Remember back in the history section where I was like, hey, this one person did a chemical analysis where they found that this one part of the plant only broke down and was only still present in preparations that used alcohol. That is the only study that has been done that backs up what many midwives say, which is that if you process blue cohosh in alcohol, it is an abortifacient and an emmenagogue and should never ever be used by a pregnant person. But if you use, unless they are seeking an abortion intentionally, or trying to bring on labor and they're willing to assume the risk. We'll get into it, but certainly not as a part as preparator. Certainly not for 4 to 6 weeks during pregnancy when you want to keep the child, the fetus. There isn't any evidence other than anecdotal accounts.
This is the anecdotal conventional
Like my brain is
wisdom. This is the anecdotal conventional wisdom. And there is a single study, but without being repeated and verified, shouldn't be considered reliable.
No, they had not isolated all of the components of blue cohosh when that study was performed. So there could be components of blue cohosh that still wind up in the glycerin that are unsafe. Anyway.
My take on anecdotal, orally transmitted common knowledge is trust but verify.
Trust but verify.
And it has not been verified.
No. The triterpene glycosides found in blue cohosh have been reported to have significant oxytocic activity owing to smooth muscle stimulation by an unexplained mechanism. If blue cohosh does stimulate contractions in the uterus, it is oxytocic and abortifacient rather than a relaxant. In 1954, experiments were conducted by Ferguson and Edwards using rat uterine horns in early estrus. I'm not going to get into it. I wrote down all the what glycoside, what dosage. Basically, they found that large doses of blue cohosh do cause an increase in tone and rate of uterine contraction, and that the same thing was caused by, rather than high doses, long-term low doses.
Meaning that there is a cumulative effect.
And there are other animal studies. I have them all here in the notes for those of you who do receive the notes, but I could spend an hour detailing all of this. Basically, all the studies that were performed on animals or on in vitro tissues found that high doses of blue cohosh cause uteral contractions, and low doses of blue cohosh for a longer period cause the same, if not stronger, uterine contractions. From the clinical studies, an herbalist can conclude that blue cohosh causes the smooth muscle of the uterus to contract, not relax, and that this contraction occurs at all stages of pregnancy, from early in implantation to shortly before labor. It is possible that if an herbalist could produce an extract from blue cohosh that contained only the estrogen-like substances and not the glycoside, then it might have a relaxing effect. However, other estrogen-like substances are still unsafe to ingest during pregnancy if the pregnant person is not seeking an abortion or to induce labor. So I'm just taking a stance on this that's going to put me at odds with a bunch of midwives and herbalists. It contracts the uterus. It isn't safe during pregnancy unless you are at the end of pregnancy and you're trying to induce labor, or you're at the very beginning of pregnancy and you're trying to induce an abortion, which I wouldn't say makes it safe. Abortifacients are not safe,
effective,
but try and do
necessary.
Safer, saner, risk-aware. Almost all abortifacients are poisons. It's all a matter of dosage.
Right, that's why they're effective abortifacients.
Yeah.
Side note that you are at 52 minutes. I don't know.
So
how
I
far
think we
through
may
the
have to
material
do
you
this
are.
as 2 parts.
I think you're right. So be on the lookout for a good break point.
Yep.
Just wanted to flag that.
Blue cohosh also has vasoactive effects. In studies performed in 1954 by Ferguson and Edwards, blue cohosh caused cardiac arrhythmias, including bradycardia, tachycardia, and systolic arrest. A series of small doses ultimately culminated in the toxic effects equal to those produced by a single large dose, which again suggests that blue cohosh has cumulative effects. Constituents found in blue cohosh affect blood pressure. Magnofluorine has been shown to induce decreased arterial blood pressure in rabbits. Colosaponin and colophylosaponin, derivatives of heterogenin, are reported to be cardiotoxic and hypertensive, possibly due to vasoconstrictive activity. N-methylocytosine, which is pharmacologically similar to but weaker than nicotine, has demonstrated hypertensive effects. The triterpene glycosides may cause constriction of coronary blood vessels. It can be determined from all of this that cumulative long-term doses or high doses of blue cohosh are cardiotoxic, with both hypotensive and hypertensive actions. The teratogenicity and mutagenicity of compounds in blue cohosh, particularly of the quinolizidine alkaloid anagyrine, have been observed in cattle. Cattle that graze on blue cohosh during the early term of their cattle pregnancies give birth to calves suffering from a disease referred to as crooked calf disease. However, this occurs only when blue cohosh is ingested during the very earliest period of gestation, and it has not been observed in pregnant sheep who graze upon the plant. So, grain of salt. N-methylcysteine, which binds to nicotine receptors in the central nervous system, analogously to nicotine, has demonstrated teratogenicity, which causes open anterior neural tube defects and poor absent eye development, including retardation of growth and morphogenesis. These all occur only when high doses of blue cohosh are ingested very early in the first trimester. However, because the herb has been historically used and continues to be used as an emmenagogue and abortifacient, obstetricians, midwives, and herbalists should remain aware that an unsuccessful abortion after use of large doses or long-term smaller doses of blue cohosh should be followed by a clinical abortion, as there is a high risk of anomalies in the surviving embryo or fetus. Now, I'm just going to say that again. If someone is using blue cohosh to perform an herbal abortion and that herbal abortion is unsuccessful, they should absolutely seek a clinical abortion thereafter, because there is a chance that their child will be born with birth defects. And
a fairly high one, based on the animal studies.
Yeah, it's not a good idea. So I guess I want to ask you all, we are at 12 pages of 28. Do I want to try and get through the incidents of poisoning tonight? Or do I want to cut there, having covered the history and the effects on the body? You know what, why don't we go ahead and get through, and we can pick up next time on medicinal uses.
Okay.
Yeah?
Yeah.
Cool.
Let's have fun with people getting poisoned.
Yeah, these aren't fun. Trigger warning, if you don't want to learn about people who were trying to keep their infant and who had some bad things happen to them, maybe don't listen to this next part. So just trigger warning for that.
Right. And in fact, go ahead and cut here because, you know, this
We're going to
next
get
part
through
is the end of
incidents
class.
of poisoning, outcome, and management. So basically, if you are poisoned, what can you do? And then next time we'll pick up with medicinal uses, magical uses, how to grow it, how to harvest it.
Yeah.
Cool. All right, and actually I like that divide instead of doing
that
this as a
works.
2-hour class. How do you all feel about it? Normally we just get through it
But
and we do 2 hours. But we've
That's
been
kind of
talking about
exhausting
how
there in
hard
one
it is
session.
for people to watch that.
yeah.
Okay. Incidents of poisoning. Several case reports in the scientific literature link ingestion of blue cohosh in the weeks prior to labor with perinatal stroke, acute myocardial infarction, and congestive heart failure, and multi-organ hypoxic injury. In spite of these known concerns and the high prevalence of its use, the safety of this herb has not been well studied. The unevaluated and prevalent use of blue cohosh as a late pregnancy tonic represents a potential maternal fetal public health concern. I don't like the phrase maternal fetal, but never mind. It was the best I could I don't have time to talk about how sometimes I have trouble finding language that I feel is inclusive enough, and I am absolutely happy to take recommendations from the crowd, and I'm just going to move on. As blue cohosh was used safely by First Nations people and by physicians during the 19th century, there is a possibility that the increasing rates of toxicity and poisoning from blue cohosh are related to herbal products that contain too high a concentration of the plant or which are contaminated. Part of the problem with buying herbal products off the open market is that many of them are just whatever they want to stick in a capsule. There was a study done of capsules from a bunch of different herbal providers, and some of them were found to contain just random weeds from like ditches, and some of them were found to contain massive amounts of sawdust and no plant matter whatsoever, and others, and this is really relevant for blue cohosh, and we'll get into it more when we talk about harvesting, contained, it's not the right words to say more of or a stronger dose of the plant. So for example, for blue cohosh, the capsules were found to contain the dried root, the straight up dried root, which when we get into harvesting and use of the plant, you should never just sit down and nom on blue cohosh root. That is an incredibly high dose of all of the harmful constituents of the plant.
So can I
Yes.
interject from off screen for a second?
Mm-hmm.
Part of the motivating factor between chemistry and, in fact, the entire pharmaceutical industry is a desire to take plants with naturally occurring beneficial properties and extract the exact thing that has those beneficial properties and be able to control the exact amount of it that you are giving someone without giving them anything that only causes side effects.
Mm-hmm.
The construction of herbal supplements is not nearly as careful and precise in most cases. However, the preparation that is used is still relevant, and the goal should still be to isolate as many of the desirable effects from the potentially undesirable effects as possible. They were doing the wrong preparations. They were concentrating the harmful side effects and minimizing the beneficial effects.
Exactly.
And while it's still technically derived from the plant they said it was, so it's not false advertising, they were doing it in a completely, not only ignorant, but actively backwards fashion.
Right, actively backwards and actively harmful. And Riley Tay, I did see that question. Yes, that actually does happen. So I'm going to just really quickly give the example of clover. Clover is a plant that at certain temperatures will develop a protective substance to either repel animals from eating it or basically protect itself from the heat, and there's sort of theories as to which one it is. In some temperature zones, clover is perfectly safe, like common white and red clover, perfectly safe to eat, to put in salads, to have in tea. It makes a delightful tea. But in high temperature areas where there are not enough frosts, so the south of the United States, basically the west coast, it would not be safe in Nevada, it would not be safe in Arizona, it would not be safe in Texas, it would not be safe in Florida, it would not be safe in Southern California. it makes this protective substance and is actively harmful to drink. Which is why in some areas of the United States, as you're growing up as kids, your parents may have said, don't eat the clover, it'll make you sick. But in other areas of the United States, they're like, yeah, eat the clover. As climate change occurs and temperatures skyrocket, areas where clover was safe to eat, it isn't safe to eat anymore. And if global temperatures keep going up, in a few generations, that plant may be listed among common yard poisons instead of common yard edible plants. So it does happen. And it doesn't help that in many cases, we're working off knowledge from the very early scientists.
Right.
And
the fact of the matter is, scientific inquiry went in different directions.
Yeah.
Which isn't intrinsically a bad thing. But it means that a lot of this knowledge could stand to be revisited.
Okay. Herbal products are not well regulated. Tests performed on blue cohosh tablets sold by various herbal companies have demonstrated that they can contain anywhere from several hundred to several thousand milligrams of the herbs, raising the level of alkaloids and saponins a person may ingest far past safe levels. I cannot stress enough that if you are going to use poison path plants, you need to find a reliable herbalist. The problem is I don't get along well with a lot of other herbalists. I don't get along well with most people though, so I mean,
Well,
fetal complications, including intrauterine death, begin to increase after 40 weeks gestation, independent of blue cohosh use. So the longer you are pregnant, if you are a pregnant person, past 40 weeks gestation, the more there is a chance that the child will die. Most pregnant persons do not ingest blue cohosh until 40 weeks gestation in order to induce labor. And the symptoms of past-term pregnancy on a pregnant person and the effects that it has on the fetus are very similar, if not identical, to the symptoms that overdose of blue cohosh can cause. Therefore, it is difficult to determine whether negative effects are due to imprecise dosage, high levels of toxic principles, or simply past-term pregnancy effects on the body of the pregnant person and the fetus. And again, there haven't been any studies. So, the publication of the first case report went mostly unnoticed as it was a small mention in an obscure New Zealand medical journal. A total of 4 case reports have appeared in the literature suggesting toxicity or adverse effects associated with blue cohosh ingestion. In 1986, Gunn and Wright, blue cohosh and black cohosh were administered by a midwife to a woman at 41.6 weeks gestation in an attempt to induce labor. The infant was unable to breathe spontaneously at birth and had to be resuscitated. The infant was transferred to the hospital for mechanical ventilation. The infant was reported to have seizures and presented with acute tubular necrosis. Computerized tomography showed parasagittal hypoxic injury. At 3 months, the infant had lower limb spasticity and required nasogastric tube feeding. There was myocardial toxicity possibly related to blue cohosh ingestion, but which also could have been due to an inadequacy of resuscitation of a fetus that wasn't breathing. In 1998, Jones and Lawson, an infant 20 minutes after birth, developed respiratory distress, acidosis, and shock. The infant required intubation and mechanical ventilatory support and was transported to an infant intensive care unit. The mother had received regular prenatal care with a certified nurse midwife throughout her pregnancy and had well-controlled hyperthyroidism. She was clinically euthyroid during the pregnancy, so it was not caused by the hyperthyroidism. According to the case report, per her midwife's recommendation, the mother had begun ingesting blue cohosh in order to prepare for labor. She reported taking 3 times the dose that was recommended by the midwife. So this one's not on the midwife. The person heard the dose recommended by the midwife and tripled it. She took 3 tablets a day for 3 weeks rather than 1 tablet a day for 3 weeks as prescribed to her. The mother reported increased uterine activity and decreased fetal movements during this time. So the person who was pregnant, who the study refers to as a woman, but I'm always hesitant, so the person who was pregnant felt that her uterus was contracting more than normal, and the infant was moving less than normal, and still continued taking a high dosage, higher than prescribed. So, chest radiography of the infant revealed cardiomegaly and pulmonary edema, and an echocardiogram demonstrated evidence of an acute anterolateral myocardial infarction, and the ECG also showed extensive regional wall motion abnormalities. Ventricular function was severely depressed, and severe mitral valve regurgitation was present. The infant had significant pulmonary hypertension. The infant's condition gradually stabilized and began to improve. Follow-up echocardiographic studies confirmed the absence of a congenital coronary artery anomaly that would explain the infant's course, and viral studies demonstrated no evidence of an acute infection. At 2 years of age, the child had good exercise tolerance and normal growth and development, however required continued digoxin therapy for persistent cardiomegaly and mildly reduced left ventricular function. The circumstantial evidence suggested that the cardiac injury was due to the high maternal ingestion of blue cohosh. In 2002, a 21-year-old non-smoking woman at 5 to 6 weeks gestation had taken 10 to 20 doses of an unspecified amount of blue cohosh tincture daily for 4 days in an attempt to induce an abortion, and presented to the emergency department complaining of 2 days of abdominal pain and bilious vomiting. On examination, she was hypertensive, tachycardic, diaphoretic, weak, and had anterior abdominal wall fasciculations. Her gynecological exam showed a non-tender uterus without cervical dilation. She was diagnosed with acute nicotinic poisoning, treated with IV rehydration, and her gastrointestinal complaints resolved, with the patient reporting only mild low pelvic cramping. Voluntary clinical abortion was performed at an outpatient procedure, and the patient was discharged 24 hours after hospital presentation. It is likely that her nicotinic toxicity symptoms were a result of the nicotine-like activities of N-methylcytosine in blue cohosh. The toxicity likely resulted from taking too large of a dose, but we don't know that. But one of the scary things in that particular case is that she was taking this very high dose, and it started killing her before it caused an abortion.
Yeah.
In 2004, a mother was advised by an obstetrician to ingest a tea of blue cohosh at an unknown strength and dosage at just over 40 weeks gestation. There was a failed attempt at vaginal birth, so a cesarean was performed. The infant demonstrated focal motor seizures of the right arm that developed 26 hours after birth. At 2 days of age, the CT of the infant showed left middle cerebral artery infarction. The infant developed excessive blood clotting, though there was no family history of embolic or thrombotic disease. The infant's urine and meconium tested positive for the cocaine metabolite benzoylicogonine. Testing of the contents of the mother's blue cohosh and the contents of a sealed bottle of a different preparation of the herb gave the same results. As this is a metabolite of both cocaine and blue cohosh, it is possible that the blue cohosh contained an unusually high amount of the metabolite, though it is also possible that the blue cohosh was contaminated with cocaine. So it's not that the mother was doing cocaine. It's that the herb had it in it. So either she bought from a contaminated source, which happens, or something happened to the blue cohosh where a metabolite that it does contain was the primary component of the blue cohosh that she was taking. This is the problem with things that contain alkaloids and glycosides and terpenes, is that, did you have a particularly hot summer? Did you plant in really acidic soil? You know,
right, remember that
all of this
conversation about
changes things.
about the motivation behind.
Well, it's also one of the reasons you need to pay attention. When you are taking a substance that is potentially poisonous, you need to have an eye on what it causes to happen to your body, and you need to seek help quickly. And unfortunately, in the United States, that can set you back a few $1,000s, or you can be told that you need to lose weight or go on anti-anxiety medications. Nothing's wrong. Or maybe you're not safe to do so. A lot of the people who seek herbal abortions do so because it is their only resort, and there isn't a safe way to go to someone and say, hey, I took this herb and now I'm having all these effects. Though with blue cohosh, I would like to point out that if a doctor goes online, you can find it recommended as a relaxant for your muscle spasms. So if you, as a person who just found out that you were pregnant, said, I've been having this real bad muscle spasms, doc. I had to take this. Anyway, I would never recommend that you do that. Okay. Surveys conducted of midwives who reported that their clients had ingested blue cohosh during pregnancy by McFarlane et al. In 1999 and by Alere et al. In 2000 revealed cases of negative outcomes and poisonings. Although 62.9% of midwives reported no adverse outcomes of poisoning, 22 adverse neonatal events were reported, an overall adverse event rate of 24.4%. That's high. That's high for an herb that's in common use. We start pulling medications from the market at 24.4% adverse outcome, way before that.
Barring things like chemo drugs where adverse outcomes are a known effect and you're hoping it kills the cancer first.
Yes.
This is not one of those cases.
The reported adverse events included meconium at birth, 10 cases, bradycardia at birth, 4 cases, tachycardia at birth, 5 cases, and the need for resuscitation at birth, 3 cases. Other adverse outcomes specified by surveyed midwives included, but were not limited to, baby developed CP after birth. Medical advisor tried to relate it to the blue and black cohosh she took 2 to 3 times during labor. Brain damage at birth. Mother had taken blue cohosh for 1 week prior to birth. Clinical treatment, outcome, and management. When a person has a toxic reaction to blue cohosh, symptoms typically follow a biphasic pattern. The early phase consists of alkaloid and nicotinic cholinergic stimulation, resulting in symptoms such as abdominal pain, hypertension, tachycardia, and tremors. The second inhibitory phase is delayed and often heralded by hypotension, bradycardia, and dyspnea, finally leading to coma and potential respiratory failure. Immediate emergency care by a physician is strongly advised. The primary emphasis of clinical care in blue cohosh poisoning is cardiovascular and respiratory support to ensure recovery. With prompt supportive care, most people who are suffering from a toxic reaction to blue cohosh make a full recovery. So I'm going to sum up, as I do, and then I think that next week, I wasn't paying attention. Is everyone okay with doing another class where we cover the medicinal uses and harvesting and all that?
I think so. I also think that it's 9:40
Yeah,
at
it's
night.
9:40 at night, and I should probably go rehydrate and eat something.
Yeah.
Where was I? Right. To sum up, the plant was used by First Nations people, but what they used it for was as an abortifacient and to induce or quicken labor, right? Then the naturopathic and eclectic physicians start recommending it as a Pardis preparator. So for use is 4 to 6 weeks. Oh, sorry, the First Nations people also used it as an emmenagogue. That's important. 4 to 6 weeks before labor, right? And this becomes popularized by the midwives and nurse midwives and herbalists of the 80s and 90s. At which time, the herb that is available on the market is untrustworthy. I'm just going to say untrustworthy. Okay? And we start seeing really adverse effects that were not common during First Nations use. Okay? Which would imply that using it in certain ways while not being safe is safer, right? While not being like a tea that you should sit down and drink the same way that we drink Camellia sinensis, it's not, you can make a risk-aware choice. And those uses are as an emmenagogue, so to induce the menstrual flow when it won't come, as an abortifacient, which is never safe, but you can do it in a safer. Saner, risk-aware fashion. Or right at the end of labor, briefly, very briefly. And if it doesn't work to induce labor at the end of pregnancy, then you don't stay on it. The First Nations people didn't record staying on it for weeks at a time while trying to keep a fetus.
Right. It is possible that the herb itself has changed, but the use pattern has also changed. The use pattern
changed. Additionally, First Nations people were walking out into their surrounding lands and harvesting it. Now, the plant is being harvested, now the plant is being harvested by these companies who are putting it into capsules with weeds and sawdust and potentially cocaine. And it's being used differently. And the way it's being used is having adverse outcomes. And the adverse outcomes seem to be increasing as the use pattern changes. So I think we'll have to stop there. But basically what I wanted to say is sometimes we have a tendency to think that because somebody's been doing it for 20 years, that means it's okay. But if you look at use patterns, you can say, oh, well, this is safer. This is not safe. That's sort of the conclusion of how poisonous, how harmful. Which, again, puts me at odds with a lot of herbalists.